Dr. Shannon M. Clark here. I'm a double board certified OBGYN and maternal fetal medicine specialist, and I want to address this post right here. This post is about stillbirth or intrauterine fetal demise, IUFD, so if this is not something you want to listen to, please scroll on. Okay, this post is from a doula over on a different platform, and she's talking about the risk of stillbirth from a study of over 470,000 low-risk pregnancies, and she lists the risk, as you can see, at 37, 38, 39, 40, 41, and 42 weeks, and she says the stillbirth risk is highest at 37 weeks and lowest at 41 weeks. She then talks about how the average length of pregnancy in 1990 was 40 to 41 weeks, and then in 2020 it's 37 to 38 weeks. Why? She's insinuating it's because of inductions of labor, and she is saying, why are we doing this if the risk of stillbirth is lower from 40 weeks on? Well, let's chat about that, because she actually shared a resource. And this is the resource: Fetal Mortality at and Beyond Term in Singleton Pregnancies in Baden-Württemberg, Germany, herein referred to as BW, from 2004 to 2009. They looked at the risk of IUFD and low-risk pregnancies at and beyond term under conditions of fetal monitoring in BW, and they specifically compared it to a few other countries within their area. They found that there was a markedly lower risk of IUFD between 37 and 0 weeks to 42 and 6 weeks of pregnancy when compared with data from Scotland, England, and Sweden. So they compared themselves to Scotland, England, and Sweden when their data was collected between 1985 and 1996. So they concluded, when comparing themselves to those other countries, the risk of IUFD in pregnancies going beyond term is remarkably lower than in those studies coming from those countries. So their results do not support current guidelines, which recommend a routine induction of labor practice in low-risk pregnancies at 41 plus 0 weeks of pregnancy, which I'm assuming was going on in that area of Germany at that time. But again, that was in 2014 when that study was published. Now, what she left out was this very important table right here. Now, it starts in the very far left column, 37 plus 0 weeks to 37 plus 6, then 38 plus 0 to 38 plus 6, all the way to 42 plus 6 weeks of pregnancy, or WOP. And then next to the last column right here is stillbirths per 1,000 pregnancies going into the week of pregnancy. And as you can see, well, you may not be able to see, it starts at 0.22 at 37 plus 0 to 37 plus 6, and it gradually increases to a rate of 8.85 to greater than 42 plus 6 weeks of pregnancy. Now, what this doula put in her slide was this very last column, which is stillbirths per 1,000 births in week of pregnancy. And that is different. And if you calculate it this way, their stillbirths were highest at 37 plus 0 to 37 plus 6. But this is what the authors have to say about that. For comparison, the last column, which is what I just mentioned, lists the rate of stillbirths per 1,000 births of the week, a parameter which is still calculated in some countries. With that misleading calculation, the levels steadily drop from the 37th week of pregnancy and only start rising again after 41 plus 6 weeks of pregnancy. Misleading calculation. Key. Another important graph that she just happened to leave out of that very sensationalized post is this one right here. Scotland in green, England in brown, Sweden in red, US, California in purple, and then BW, place in Germany, in blue. This is the risk of stillbirths per 1,000 ongoing pregnancies in week of gestation, starting at 37 plus 0 weeks and going to 42 plus 6 weeks. And as you can tell, for every country, it steadily increases and then takes a sharp increase at 41 weeks and beyond. Now, it didn't in BW, the blue line, at this 41 week mark. But they were, again, in the study, were comparing themselves to Scotland, England, and Sweden, and nobody else. So the whole purpose of their study was to compare themselves to those countries, which overall, they did have a lower rate of stillbirth between 37 and 0 weeks of pregnancy and 42 plus 6 weeks of pregnancy. So what that doula posted was absolutely misleading, incorrect, sensationalized, and presenting false information and a false narrative, period. And that's either because she meant to, or she doesn't know how to read a research article. And I'm not sure which is worse. Now, this chart or graph here is from ACOG's Management of Stillbirth, which is an obstetric care consensus, number 20. And this is prospective fetal mortality rate by single week of gestation in the United States in 2013. So this data is also old. However, if you go to 37 weeks and beyond, you can see the very steep increase in the risk of stillbirth with ongoing gestation, starting at that 37 to 38 week mark. And this is a recent study from 2019, I believe, risk of stillbirth and neonatal death with advancing gestation at term, a systematic review and meta-analysis of cohort studies of 15 million pregnancies. Now, these authors are out of the UK, and they did this study for a couple of reasons. Number one, a third of stillborn babies in the UK are born at term, which is a greater than 37 weeks, and were previously considered to be healthy. Prolongation of pregnancy at term is known to be a risk factor for stillbirth. Currently, women in the UK are offered induction of labor after 41 weeks gestation to avoid stillbirth, but 1 in 3 women have a stillborn baby prior to the gestational age. Mothers need robust estimates of potential risk of stillbirth and newborn death at term to make decisions on timing of delivery. So what did they do? They collected data from all relevant studies found in a systematic review and determined the additional risk of stillbirth and newborn death in mothers at term gestation by comparing pregnancies that continued versus delivered at various gestational ages. And they looked at stillbirth across the whole entire globe. What did they find? They found a steady increase in the risk of stillbirth with advancing gestation at term. And mothers who continued their pregnancy to 41 weeks, there was a 64% increase in the risk of stillbirth compared to those who delivered at 40 weeks, with one additional mother having a stillborn baby for every approximately 1,500 women. The risk of newborn death remained constant between 38 and 41 weeks and only increased beyond 41 weeks. And then here is the graph. Prospective risk of stillbirth per 1,000 pregnancies and risk of neonatal death per 1,000 deliveries by gestational age and pregnancies continue to term. The stillbirth risk is in the black line, and the neonatal death risk is in the solid red line. And as you can see, the risk steadily increases from 37 to 38 weeks up to 43 weeks. This is the real data, not what that doula was trying to sell you. So look, I know this video is long, but y'all need to know the truth. These people are either doing this intentionally or they truly don't know how to read a research article, which is scary to me either way, because they're putting this trash out to people who actually believe what they're saying. And they throw in a PMID number in there to make it look like they've done the research, but they only included one study and didn't even interpret it right. I know stillbirth is a terrifying topic to discuss, but we have to discuss it. Patients have to be educated on it and have these conversations with their obstetrical care providers if there are any concerns. So please ask questions and stay away from accounts like that one I just mentioned.